Hello everyone, today we're going to be learning about the differences between Hodgkin's lymphoma and non-Hodgkin's lymphoma. Before we start, I'd like you to have a quick go at this quiz. We'll come back to it at the end of the video to go over the answers. Firstly, if you've been watching my previous videos, by definition, Hodgkin's lymphoma and non-Hodgkin's lymphoma, they're both cancers of the lymphocytes. Non-Hodgkin's lymphoma can typically impact very particularly on B cells, T cells, and also our natural killer cells. The Epstein-Barr virus. Now, that is a similarity. The Epstein-Barr virus infection is a risk factor for both Hodgkin's and non-Hodgkin's lymphoma. Cancer of lymphocytes. A similarity. Both Hodgkin's and non-Hodgkin's lymphoma are cancers of the lymphocytes. In Hodgkin's lymphoma, it typically originates from the lymph nodes of the neck and tends to spread throughout the body depending on the staging. Whereas in non-Hodgkin's lymphoma, the cancer of the lymphocyte can originate from other areas such as the liver, the spleen, and the bone marrow. Autoimmune diseases such as rheumatoid arthritis, systemic lupus erythematosus, Sjögren's disease, and celiac disease overstimulate the white blood cells such as lymphocytes and therefore increase the risk of the lymphocytes metastasizing, and therefore both of these autoimmune diseases are a risk factor for both Hodgkin's and non-Hodgkin's lymphoma. A key difference that you want to keep in mind is the presence of Reed-Sternberg cells. Now, these are described as mononucleus cells with very large nuclei, almost having an owl eye appearance. Upon lymph node biopsy, this will be present in Hodgkin's lymphoma and is a very key characteristic of Hodgkin's lymphoma. However, you will not find this in non-Hodgkin's lymphoma. Another key difference is the age of onset. So non-Hodgkin's lymphoma tends to have a later onset and tends to present more in the elderly, so over 80s. B signs are both a similarity of Hodgkin's and non-Hodgkin's lymphoma. This includes unintentional weight loss, fever, night sweats, as well as lethargy. A key difference in the symptoms is that the lymphadenopathy or the non-tender neck lump, which is a swollen lymph node in the neck that you may observe in Hodgkin's lymphoma, will typically become more painful after the patient has consumed alcohol. So look out for that in test questions. The Ann Arbor staging is a similarity. It can be used to stage both Hodgkin's and non-Hodgkin's lymphoma. In stage 1, there is only the cancer is localized to just the lymph nodes of the neck, so a single lymph node. In stage 2, it has spread to 2 or more lymph nodes on either side of the diaphragm. So this can include the axillary lymph nodes or the inguinal lymph nodes in the groin. In stage 3 of the Ann Arbor staging, the lymphadenopathy has definitely spread to both sides of the diaphragm, so it can be present in the neck, the axillary nodes, the inguinal nodes. However, it won't have metastasized to other organs. In stage 4, however, it has definitely metastasized and spread to extranodal areas, to other organs, such as the liver, the spleen, the bone marrow. And stage 4 has the worst prognosis. In terms of treatment, ABVD, which stands for andriamycin, bleomycin, vinblastine, and dacarbazine, is an intensive chemotherapy regimen treatment that is used in Hodgkin's lymphoma. R-CHOP can also be used in late stages of Hodgkin's lymphoma. So it stands for rituximab, cyclophosphamide, hydroxyduanrubican, and vincristine and prednisolone. And R-CHOP is a chemotherapy regimen and treatment that is used both in non-Hodgkin's, Hodgkin's, and non-Hodgkin's lymphoma. Now going back to the quiz. Let's go through this. Number 1. Name 2 overlapping risk factors for both non-Hodgkin's and Hodgkin's lymphoma. So the first risk factor being the Epstein-Barr virus infection, as well as other infections such as HIV. Another risk factor would be having an autoimmune disease, such as SLE, rheumatoid arthritis, celiac disease, Sjogren's disease. Another risk factor would be family history of lymphoma, as well as age. So being elderly increases the risk of cancer. 2. Describe the lymph node biopsy findings that differentiate Hodgkin's and non-Hodgkin's lymphoma. So as we went through before, the presence of Reed-Sternberg cells is a characteristic and a defining characteristic of Hodgkin's lymphoma, and it won't be present in non-Hodgkin's lymphoma. 2 subtypes of non-Hodgkin's lymphoma include Burkitt's lymphoma, which typically has a very described to have starry sky appearance on a biopsy, and the Molt lymphoma, which is has a gastric presentation. So 4, name a cause and some symptoms associated with gastric Molt lymphoma. So it's typically caused by the H. pylori infection, and some of the symptoms can include abdominal pain, dysphagia, dyspepsia, difficulty swallowing, things like that, and a loss of appetite. Name 5 chemotherapy drugs that can be used in high-grade treatment of non-Hodgkin's lymphoma. So RCHOP. RCHOP stands for rituximab. It stands for rituximab, cyclophosphamide, hydroxydownrubicin, vincristine, and prednisolone. So just count up your scores for what you got in the quiz and comment down below. I hope this video helped in helping to provide a clearer distinction between Hodgkin's and non-Hodgkin's lymphoma. Please write anything in the comments if you have any questions below. Thank you.